हेलो एवरीवन एंड वेलकम टू बुलेट पॉइंट्स इन फोरेंसिक मेडिसिन वीडियो 5 और इस वीडियो में जो चीज़ हम देख रहे हैं एज यू कैन सी ऑन द स्क्रीन वी आर टॉकिंग अबाउट स्कल फ्रैक्चर्स. Skull fractures are very important as far as forensic medicine is concerned because skull is a combination of multiple bones and in different situations different kind of skull fractures are seen. Identifying those skull fractures correctly can tell us कि वो फ्रैक्चर किस तरीके के सिनारियो में हुआ होगा. So skull fractures have their own medico-legal significances. Okay, let's see हमारे prototype questions, दो ऐसे questions which will give us into the idea of what exactly are we talking in this segment. So the first question is, what fracture is seen in skull? What fracture in skull would strongly suggest fall from height? Right, very straightforward question. There is a person who has fallen from height, and what fracture during autopsy would strongly suggest that this is a case of fall from height itself. Okay, the second question is, during autopsy it is seen that the junction between the frontal and the left parietal bone is separated. What is it called? Okay, so what is it called if the junction between the two bone is separated? What kind of skull fracture is it called? ठीक है, दोनों ही फ्रैक्चर्स के बारे में अभी हम अगले सेगमेंट में अपनी देखेंगे क्या डिफरेंट काइंड ऑफ स्कल फ्रैक्चर्स होते हैं, किन मेडिको लीगल सिनारियोज में वो कॉमनली पाए जाते हैं, और इन दोनों क्वेश्चंस का आंसर उस टेबल को देख करके आप मुझे कमेंट्स में दोगे. सो लेट्स टॉक अबाउट स्कल फ्रैक्चर्स. राइट, सो व्हाट आर डिफरेंट काइंड ऑफ और टाइप ऑफ स्कल फ्रैक्चर versus what is the medico-legal significance of that fracture if it is seen during autopsy. The first is called as the linear fracture, also known as the fissure fracture. Right, now the medico-legal significance of this fracture is that it is the most common kind of skull fracture seen. What is a linear or a fissure fracture? So if you see the vault of a skull, if we have a simple straight crack line like this, or even if it is a kind of a zigzag crack line, it is called as a linear or a fissure fracture, most commonly seen in skull autopsies. Second is ring fracture. Ring fracture is a fracture which is seen in the base of the skull. So if you see base of the skull, right, it is divided into anterior cranial fossa, middle cranial fossa and posterior cranial fossa. Right, in posterior cranial fossa we have foramen magnum. If we have a fracture which is running like this all around the foramen magnum, like surrounding like a ring, that's called as a ring fracture. Okay, it's called as ring fracture. Even if it is not surrounding the foramen magnum completely, even if it is only a partial encircling of the foramen magnum, it is still called as a ring fracture. What is the medico-legal significance? It signifies fall from height. Right, it signifies fall from height. It strongly signifies fall from height. Third is hinge fracture, also known as the motorcyclist fracture. Right, the significance of hinge fracture is it signifies a two-wheeler driver accident commonly seen in road traffic accident, RTA, involving two-wheeler driver, because they wear helmets, and sometimes when they meet with road traffic accident, what happens is their skull may get cracked. Again, in the base of the skull you see this kind of a crack. So if this is, let's say, the base of the skull, and you see a crack line going from one middle cranial fossa through the body of sphenoid and ending into the other side of the middle cranial fossa, thus dividing the base of the skull into two halves, an anterior half and the posterior half, right? Where the vault is intact. So vault of the skull is intact, but the base is cracked, right? In the middle cranial fossa, a horizontal crack is there, dividing the base into an anterior and a posterior segment. This is called as hinge or motorcyclist fracture. Then we have something called as gutter fracture. Again, very important, because gutter fracture can only be produced by a very fast moving weapon which hits the periosteum tangentially, and that weapon is a bullet. So if there is a bullet which is revolving on its axis, it grazes the skull, it hits the skull curvature tangentially, it ends up creating a gutter in the periosteum. That is called as gutter fracture. Okay, so medical legal significance of gutter fracture is it is produced by a bullet grazing the periosteum. So gutter fracture signifies a bullet fire. Okay, then we have diastatic, also known as the sutural fracture. So either you call it as a diastatic fracture or you call it as a sutural fracture. Diastatic or sutural fracture is a fracture where actually the bone doesn't crack, but the junction between the two bones open up, right? The junction between the two bones open up. The suture of the skull opens up. It signifies compressing force on fixed skull. So consider if the skull is fixed from one side and there is a heavy compressing force coming from the other side, it will increase the intracranial pressure, and thus the pressure will get released by cracking the weakest portion of the bone, and the weakest portion of the bone in the skull are the sutural junctions. So sutures may separate, and that is called as diastatic or sutural fracture. That is exactly what has been asked in question number 2, if you recall, of this video. Then we have something called as depressed fracture. Depressed fracture is seen on the vault of the skull or the curvature of the skull. So if you see, let's say this is the curvature of the skull, and we hit the curvature of the skull with a hammer. Okay, let's say we hit the curvature of the skull with a hammer. So what kind of a weapon is a hammer? Hammer is a blunt, heavy weapon with a short or a small striking area. So although it is blunt and heavy, but the striking area is small. When these kind of weapons hits the curvature of the skull, what do? They crack the curvature of the skull like this. They crack the ectocranium in the hitting circumference of the hammer. So hammer will crack the ectocranium into a circular kind of shape, and that cracked ectocranium will get depressed into the endocranium. So what do we see here? We see here cracked ectocranium getting depressed into the endocranium in the circular shape, and that is the shape of the hitting area of the hammer. So ectocranium gets depressed into the endocranium. The shape is the hitting circumference or surface of that blunt weapon which is hitting the skull, and this is called as depressed fracture. Medical legal significance, it can tell us the kind of weapon that may have been involved in providing injury to the skull. Okay, so remember depressed fracture, we need to remember blunt and heavy weapon with small striking area. Again, very important thing to remember. Okay. Then we have something called as pond fracture. Pond fracture exactly is not a crack of the skull bone, it is rather an indentation of the skull bone. It is indentation of the skull bone, and skull bones can only indent when they have not been calcified yet. Yani ki the skull bone is still cartilaginous. And when is the skull bone cartilaginous? The skull bones are cartilaginous in infant time period. So pond fractures happens in infant age group when the skull is still cartilaginous, right? An indentation commonly happens during forceps delivery when a fetus is pulled out of the mother's womb by grip of a forceps. The force of the forceps can indent the cartilaginous skull of the infant, and later on when that deformity is formed as the skull gets calcified, that's called as pond fracture. Then lastly we have comminuted fracture, also known as spider web fracture or comminuted fracture, which also has a spider web appearance. So it is also called as a spider web fracture, right? What exactly comminuted fracture looks like? Consider this to be the vault of the skull, and if the vault of the skull is hit by a heavy flat surface, right, like an iron plate. Let's consider the curvature of the skull is being hit by a flat heavy iron plate. What will it do? It will depress the curvature of the skull. It will try to flatten the curvature of the skull, and thus the cracks may look like this: a circular crack with lines radiating from the center to the periphery, having a spider web appearance. Spider web appearance. And this kind of fracture can be generated by blunt heavy weapon with flat surface, with flat hitting surface. Remember, we saw earlier that blunt heavy weapon with small striking area, they will end up producing depressed fracture. But what if the blunt heavy weapon has a large flat hitting surface? They may end up producing comminuted fracture of the skull, also known as the spider web fracture or spider web appearance. Okay, all these different kind of fractures are asked in the examination, किसी क्लिनिकल सिनारियो में डाल करके या कोई ऑटोप्सी फाइंडिंग के हिसाब से. दो प्रोटोटाइप क्वेश्चंस हमने इस वीडियो में भी देखे, राइट? I hope this video helps you a lot in solving some of your questions. I'll see you in my next video. Bye bye.